Hair loss is a common problem that affects people of all genders and ages. In fact, it's estimated that 50 million men and 30 million women suffer from some form of hair loss in the US alone. But why is hair loss such a concerning issue? For starters, hair is often regarded as a symbol of beauty and youthfulness. Losing it can affect one's self-esteem and confidence. Additionally, hair loss can be a sign of an underlying health issue, such as a hormonal imbalance or autoimmune disorder. So, what causes hair loss? The answer is not always straightforward. Genetics, lifestyle choices, and medical conditions can all play a role. There are many rumors surrounding hair loss. It's time to clear up some common misconceptions. First up, frequent hair washing causes hair loss. Sorry, folks, but it's just not true. While it is essential to avoid overwashing and using harsh chemicals, regular hair washing does not contribute to hair loss. And for all your helmet and hat enthusiasts, fear not, they do not cause hair loss. However, if hats or helmets are worn too tightly, it can lead to traction alopecia, a form of hair loss caused by excessive tension on the hair follicles. Lastly, it's important to remember that hair loss affects both men and women. So let's get rid of the notion that hair loss is solely a male issue. Let's bust these myths once and for all and focus on the real causes of hair loss. In this video, we will investigate the different reasons for hair loss and debunk some common myths along the way. Get ready to learn more about your hair loss journey and hopefully find ways to address it. 1. Genetics. Genetics is the study of genes, heredity, and genetic variation in living organisms. It is an intricate field involving the study of DNA and inheritance patterns. The study of genetics has led us to advancements in medicine, agriculture, and various other fields. We have been able to map the human genome, identify genetic disorders, and develop gene therapies to treat them. Researchers constantly strive to unravel the complexity of genetics and its role in the development of traits and diseases. The study of genetics has revolutionized our understanding of the world around us, and its impact will continue to be felt for years to come. Hormonal changes. Hormonal changes can occur naturally at different stages in life, such as during puberty, pregnancy, and menopause. These changes can affect the body in various ways, including mood, menstrual cycle, and physical development. Hormones can also play a role in certain medical conditions, such as polycystic ovary syndrome, PCOS, and thyroid disorders. It is essential to understand the impact of hormonal changes can have on the body and seek medical advice if any concerns arise. Proper management of hormonal imbalances can lead to improved overall health and well-being. Nutritional deficiencies. According to recent studies, nutritional deficiencies have been found to be a major contributor to chronic diseases worldwide. These deficiencies can occur when the body is not receiving enough essential vitamins and minerals needed for proper functioning. The most common nutritional deficiencies include iron, vitamin D, vitamin B12, calcium, and iodine. These deficiencies can lead to a range of health issues such as anemia, weakened immune system, poor bone health, fatigue, and poor cognitive function. It is important to maintain a well-balanced diet to prevent nutritional deficiencies and ensure optimal health. 4. Aging. The process of aging is a natural phenomenon that every living being goes through. It is marked by a gradual decline in bodily functions, which becomes more noticeable as time goes by. Aging affects each individual differently and at a different pace. But certain changes such as the graying of hair, wrinkles, and reduced energy levels are universal signs of aging. As we age, we become more susceptible to age-related illnesses and diseases, such as diabetes, Alzheimer's, and arthritis. Thus, it is important to take care of our physical and mental well-being to ensure that we age gracefully and maintain a good quality of life. 5. Stress. Stress is a common experience that affects everyone at some point in their lives. It can be caused by various circumstances like work-related pressure, financial difficulties, relationships, or health issues. Prolonged periods of stress can lead to mental and physical health problems, including anxiety, depression, insomnia, high blood pressure, and heart disease. Therefore, It's crucial to manage and alleviate stress through relaxation techniques, such as deep breathing, meditation, yoga, exercise, spending time in nature, and seeking professional help if necessary. Making positive lifestyle changes like prioritizing self-care, setting realistic goals, and maintaining healthy relationships can also help reduce stress levels and promote overall well-being. 6. Certain medications. Certain medications can have significant effects on one's health, both positive and negative. While medications are meant to improve one's condition, they may also cause side effects that can be detrimental to one's well-being. It is important to be well informed about medications and their potential side effects before starting any new medication. It is also important to adhere to the prescribed dosage and not to combine medications without a doctor's advice. Moreover, consulting a healthcare professional before taking medications is always a wise choice to make. Following proper medication management is crucial to maintain good health and may prevent unwanted complications. 7. Autoimmune disorders. Autoimmune disorders occur when the immune system mistakenly attacks healthy body tissues. There are more than 80 different types of autoimmune disorders. Some common examples of autoimmune disorders include rheumatoid arthritis, lupus, and multiple sclerosis. These disorders can affect anyone regardless of age or gender, but certain factors like genetics and environmental triggers may increase the risk. While there is no known cure for autoimmune disorders, treatment options like medication, therapy, and lifestyle changes can help manage symptoms and improve quality of life. It is important to seek medical attention if you suspect that you may have an autoimmune disorder. 8. Physical trauma. Physical trauma refers to bodily injury caused by an external force. This could result from events such as accidents, falls, or violence. The severity of physical trauma can range from minor bruises to major injuries, such as broken bones, severe burns, or head trauma. It can also lead to long-term effects such as chronic pain, disability, or even death. In many cases, physical trauma requires medical attention and treatment to aid in recovery. Early and appropriate treatment can make a significant difference in the outcome of a person's recovery from physical trauma. 10. Infections. Infections can be caused by viruses, bacteria, fungi, and parasites. These microorganisms can enter a person's body through various means such as through the air, contaminated food or water, sexual contact, or physical contact with contaminated surfaces. Infections can lead to a wide range of symptoms, ranging from mild to severe, and can affect any part of the body. It is important to practice good hygiene and take preventative measures to reduce the risk of contracting infections, such as washing hands regularly and avoiding contact with those who are sick. Early diagnosis and treatment are also essential in managing infections and preventing them from spreading to others. 11. Environmental factors. Environmental factors play a significant role in shaping our lives, health, and well-being. We are highly dependent on our surroundings and the resources it provides us to survive and thrive. Our environment comprises several elements such as air, water, soil, plants, and animals. These elements interact with one another, and changes in one element can have a significant impact on others. The quality of our environment greatly affects the quality of our lives. Therefore, it is important for individuals, organizations, and policymakers to pay attention to environmental factors and take necessary actions to ensure a sustainable and healthy environment for the present and future generations. 12. Poor scalp health. Poor scalp health can lead to hair breakage, hair thinning, dandruff, and hair loss. The causes of scalp issues may vary from person to person. Some of the common causes include harsh hair products, lack of proper hair care, stress, hormonal imbalances, and certain medical conditions. To maintain a healthy scalp, it is important to follow a regular hair care routine. Use gentle hair care products, eat a balanced diet, and manage stress levels. Seeking medical advice from a dermatologist can also help in identifying the root cause of scalp issues and finding an appropriate solution to tackle them. 13. Chemical exposure. Chemical exposure can have detrimental effects on human health. Exposure occurs when someone comes into contact with chemicals through inhalation, ingestion, or skin contact. These chemicals can be found in various everyday products, such as household cleaners, pesticides, and industrial chemicals. Long-term exposure can lead to serious health issues, such as cancer, reproductive problems, and respiratory diseases. It is important for individuals to take proper precautions and protect themselves from chemical exposure to maintain good health. This can include wearing protective clothing and equipment, following safety guidelines, and properly disposing of chemicals. 14. Excessive heat exposure. Excessive heat exposure can lead to various health problems, such as heat cramps, heat exhaustion, and heat stroke. Prolonged exposure to extreme heat can cause dehydration and may also prove fatal in severe cases. It is important to stay hydrated by consuming an adequate amount of water, and also to limit outdoor activities during peak heat hours. Wearing light-colored clothing and using sun protection, such as hats and sunscreen, can also be helpful in preventing heat-related illnesses. 15. Tight hairstyles. Tight hairstyles, such as braids, cornrows, and ponytails, can cause hair breakage and damage to the scalp. The excessive pulling and tension on the hair can lead to a condition called traction alopecia. Traction alopecia is a type of hair loss that occurs when the hair is pulled too tightly and the follicle becomes damaged. It's essential to give your hair a break from tight hairstyles frequently, and choose looser styles to prevent damage. Additionally, using gentle hair care products and avoiding excessive heat styling can also help to maintain healthy hair. In conclusion, hair loss is a common problem that affects people of all ages and genders. It can be caused by a variety of factors, including genetics, lifestyle choices, and medical conditions. It's important to seek professional help for treating hair loss, and not fall for myths and misconceptions. Accepting and embracing hair loss as a part of oneself can also go a long way in dealing with it. Remember, hair loss does not define one's beauty or personality. Hair loss is a common problem that affects people of all genders and ages.